So it's Wednesday, March 18th, and this is an update about who should get COVID testing. Well, first and foremost, let me tell you, it's not everybody. We have limited testing available still, even though capacity is increasing and we are able to test more patients. We don't have capacity to test everyone. We all need to be thoughtful. Clinicians need to be thoughtful about who we're testing. So who should we be testing? We should be testing those individuals at highest risk of complications and where testing is going to change management. And we should be testing healthcare workers. Who shouldn't we be testing? We shouldn't be testing asymptomatic people. So if you're not sick, there's no reason to test you, even if you think you've had a contact, right? It's not going to change anything. If you don't have symptoms or if you have very mild symptoms, knowing that you're positive doesn't change management. In fact, we probably should just presume that you're positive. And what you should do if you presume you're positive is isolate yourself, self-quarantining. Be very careful about staying away from those individuals who are at high risk and frankly others. The goal is to decrease the spread of the virus. So if you're an asymptomatic person, even if you've had an exposure, you don't meet criteria for testing, and we really need to conserve the testing for those people who really need it. If you're a person where you have mild symptoms and you're young and healthy, please call us at the office. If you're doing okay, we would also encourage you to stay home and self-quarantine. You don't need to be tested necessarily. If we talk to you tomorrow or the next day and your symptoms are getting worse, at that point we can decide where you should be evaluated, either here in our office and potentially get tested here, or whether or not you're sick enough to need the emergency room, and then of course you would be tested there. But at this point, again, no symptoms, even with an exposure or very mild symptoms, please contact your physician if you have mild symptoms. We will follow you. We do want to hear from you, but the treatment is going to be the same with or without testing. And right now, for the greater common good, we need to reserve the testing available for those patients at highest risk. So if you're a patient in the practice, please, we want to hear from you. Please call us if you're having any symptoms or any questions. We are available and here to take your calls, take your emails, and see you in the office when it's appropriate, and certainly, or do a telehealth visit at home. So another update tomorrow. Thanks.